Tonight on Doctor's Diaries.
It's like a burning feeling.
With the oxygen?
It literally threatens her livelihood as well as her life.
I've tried pills, I've tried Weight Watchers. This is my opportunity. I have to do something to save myself.
I don't think there is any limit to the number of transplants that we can do on a single person.
If it doesn't work, I'll be so disappointed.
Got
Hi.
all over you.
Can you put the bed up a little?
I'm Dr. Larson. Okay, we're gonna take care of you. You're gonna be all right.
Dr. Eric Larson is in charge of the emergency room today.
Try not to be frightened. You're okay.
Cecilia LaRue, a registered nurse here at Westchester Medical Center, frequently wears latex gloves when she's working. But this time, as she was removing them, she suddenly broke out in a burning itch that spread all over her body.
We maintain a certain amount of calmness in trying to make all those decisions, because the worst thing you can do is kind of get into the franticness that already exists. Little stick.
Dr. Larson suspects Cecilia is experiencing an acute allergic reaction to the latex gloves. In some people, regular exposure to latex can trigger a sudden sensitivity to it.
And as I was taking them off, I got contact with them in both my arms, and then
I think there's a certain part of my personality that is the adrenaline junkie. So emergency medicine certainly plays into that. Do you feel like you're having any swelling in the mouth or anything like that?
that was choking me full, but I don't know whether it was.
Open your mouth. Open your mouth. You're going to be all right. You want to get some Zantac here, and we'll give her.
Getting Benadryl. You want Zantac, Benadryl?
Yeah, let's try the Zantac first.
Okay.
Okay, dear, you're going to be okay.
I've tried Weight Watchers, I've tried Nutrisystems, the Zone diet. I've tried many diets throughout the last 20 years.
Judith Skelton is 5 foot 2 inches tall and weighs almost 300 pounds. She's here today to have a gastric bypass operation, which will reduce her stomach to the size of a golf ball. With a shrunken stomach, Judith will be forced to eat less, finally making it possible to lose the weight that clearly affects the quality of her life.
One of the biggest problems with obesity is that it is an unrecognized discrimination. People who are obese are judged constantly at the job, at the workplace, on interviews, socially they are judged.
Dr. Julio Teixeira considers Judith morbidly obese. The excess fat she carries jeopardizes her health. She already has diabetes and hypertension, and both are adversely affected by her weight.
I want to be able to walk, comfortably without having to breathe heavy. I can't bend down and tie my shoes. Little things like that, tying your shoe. I can't wait to be able to tie my shoes without having a struggle. You have to be smiling now because you probably won't find me smiling later.
She came to a realization that in order to change her lifestyle, in order to prolong her life, that she needed to do something drastic in order to guarantee a weight loss.
It's for me. I mean, I've tried everything else, and this is it. Everybody says, well, it's so drastic. Well, yeah, I need drastic. I need it.
Less than 10 minutes ago, Cecilia LaRue put on a pair of latex gloves. Now she's in the emergency room suffering from a severe allergic reaction to the latex, something found in many hospital supplies, like the cap on the IV they just put in Cecilia's arm.
Wow.
What?
You shouldn't use that. It's latex.
Yo. Yeah, let's just... Well, let's give her the drug quickly.
Stop coughing on it. It's latex first.
Okay.
Really? Yep.
Okay. A little air. Yeah, oxygen. Yeah, oxygen. That'd be good.
The BP cup, since it's got latex in it.
And it gets worse. The staff doesn't realize the oxygen tube they just put on Cecilia is also made of latex.
It's just a funny feeling when I get the air in there.
Okay, you're gonna be all right.
Just like a burning feeling.
With the oxygen? Is it this?
It's not stridorous. Give her a face mask. Okay, dear. That's free. Okay. Gonna be all right. You're gonna be all right. Okay.
Better?
Okay. Try to slow down your breathing. You're gonna be all right. Okay.
All right.
Okay. Okay. The rash is actually clearing up.
Yeah.
It is.
The epi
I feel better. I feel better, my
Okay. Okay.
Try and do slow breaths.
Because you don't want to hyperventilate. That's going to get everything all whacked out. This is serious business for hospital workers, you know, because people start to develop these allergies to latex, and that's what it seems like it is. And these allergies are extreme, as you can see. This was a serious reaction here. You know, allergies can be a little bit of a mysterious disease in that, you know, what kind of provokes an allergy in one person and doesn't in the other. There's people who have had to get out of the healthcare field, doctors and nurses, dentists, simply because they have such a hypersensitivity to it. I mean, it literally threatens her livelihood as well as her life.
Summer.
1.5-year-old Summer Razul had a kidney transplant 4 weeks ago. Summer's mother, Mona, gave her only daughter one of her own kidneys.
Unfortunately, 2/3 of the kidney has died and needs to be removed immediately. The family is here today to meet with Dr. Khalid Butt, one of the surgeons who performed the original transplant.
It's okay. I don't like have any bad feelings. I know whatever happens is in Allah's hands. No, I know we never thought like that. Never. No, but we would come to you second time, third time, every time.
Summer desperately needs another kidney. A kidney from a living donor is her best chance for survival.
Dr. Butt came up with an idea. He says, well, since we have to take her into surgery to take the kidney out, when we take the kidney out, why not have somebody else give her a kidney so she doesn't have to go through the whole thing again?
This little baby gets a bad stroke of luck. The kidneys just didn't develop. But we know that little children don't do well on dialysis alone. And their physical growth, their intellectual development, their social growth, all of that develops better with a functioning kidney transplant.
Khalid Ramadan, Mona's father, just flew in from Abu Dhabi, near the Persian Gulf. Khalid hopes he can give his granddaughter a chance to live a normal life. Without a kidney, Summer will not develop like most children. Already, she doesn't have the strength to practice basic motor skills like walking.
So I said, well, that's it. If she ever requires my kidney, I'll be there for her. And I will do anything possible for that little baby.
So you're donating your kidney?
Yes.
To whom?
To my granddaughter.
God bless you.
Summer.
But nothing is certain at this point. Doctors must run a battery of tests to see if Khalid's kidney is compatible with his granddaughter's.
Does it look all right?
So far, okay. Good. Okay, in a few moments the table will be moving. Good, breathe now.
Dr. Teixeira has bittersweet news. Khalid is a match, but an X-ray reveals a growth on his kidney. which could be cancerous.
The grandfather turned out to have a mass in the kidney. We had to take that lesion out and look at it under the microscope to be sure before we transplanted that kidney into the little girl.
It's my dream now. The only dream is that I wake up from the operation and they say the kidney is working perfect inside summer and she's normal again. I'm even willing to give her the other kidney, if possible. I don't hesitate to give anything to this little baby to have a normal life.
Doctors decide to go ahead with the surgery. They'll run a biopsy on the growth when they remove Khalid's kidney. If it's benign, doctors will proceed with the transplant.
And we keep on thinking about it, hoping it's not cancer. Imagine somebody coming all this way to donate, and on top of that finding out that he's got something himself and not knowing where it is.
Balance invalid, you have to do it again. No.
Dr. Teixeira is about to perform a gastric bypass on Judith Skelton. She weighs almost 300 pounds, and this operation will prevent her from ever overeating again. Dr. Teixeira will divide Judith's stomach, normally the size of a football, into 2 parts. The new stomach will be the size of a golf ball. He will then reroute her small intestine to the new stomach, called the pouch. Today, Dr. Thomas Sarabona assists Dr. Teixeira.
We have our robotic arm that we're going to utilize. This is called ESOP, and this will actually control the camera. And it'll be set to our voice control. We'll be able to control it by our voice.
Before beginning, they insert several tiny laparoscopic cameras into Judith's stomach. The cameras allow Dr. Teixeira to see the exact placement of the instruments.
Now we can turn the overhead lights off. We're now in the abdominal cavity. You can see where our varus needle was, just into a little bit of the omentum. That's why we left it in, so we can see where it went. We'll take that out. So we're going to try to lift the omentum up so we can get to the small intestine, so we can start doing our roux loop, which we're going to do first in this case.
Down. Move down.
This will be the part of the intestine that Dr. Teixeira cuts that will be utilized to come up to the gastric pouch that we make, the small pouch.
I'm going to need another one, please, or 220 stomach.
The first step, separating Judith's small intestine from her stomach.
Now we're going to completely stand the patient up, which we've had secured on the table. And now we're going to go up to the stomach part and do the gastric stapling.
Isa, move back.
Dr. Teixeira just divided Judith's stomach into 2 parts. The new stomach is visible in the top left corner of the monitor. It will hold only 2 tablespoons of food. The old stomach will be left in, but it's useless.
Just this little bit. Everything else is just kind of sit idle in there. So that's her new stomach? Yeah, that little thing there. A little shot glass. That's it.
Now, doctors connect the new stomach to the small intestine.
When we hook up the intestine to the pouch, it's important that that hookup is so narrow that it also empties slowly, so that she has a sense of fullness when she eats. All right, I can throw out, huh?
Yeah.
All right.
Thanks, Tex.
The weight loss begins quite rapidly after the operation. A year from now, we expect her to lose about 1/3 to 40% of her body weight, which is approximately 120 pounds.
Dr. Sarabona is finishing Judith Skelton's gastric bypass.
I'll give her daughter a call. Let me get her number. By tomorrow, she'll be on liquids and drinking liquids. Have minimal pain. Be up out of bed even tonight or early tomorrow morning. Hi, is this Judy? Hi, Judy. It's Dr. Sarabona at Westchester Medical Center. So I want to let you know that everything went fine with your mom.
It's really just neurosurgery.
She's out of surgery. Anesthesiologist is waking her up right now, and then she's going to go to the recovery room. But this surgery went very well. There were no problems. We did exactly what we had told her we would be able to do, and No, we did it with the small incisions with the laparoscopy, with the mini incisions. So we were able to do it that way. We did not have to do it with the big incision. And tomorrow she'll get that special x-ray test. If that's okay, then we'll start her on liquids, and hopefully, if no problems, we'll get her home in 3 or 4 days.
The next morning, Dr. Teixeira checks in with Judith.
Judith, Dr. Teixeira, how are you? How you feeling? Okay? Yeah? All right, you did great. The operation went really well. Just take a peek over here for a second, okay? She had a very routine operation. Every time a patient has surgery, no matter how routine it is, it's serious, and you never know. But we like when it goes routine, yeah?
This is my opportunity. I have to do something to save myself. And that's how I feel, that I'm doing. I'm saving my life.
Let me just look at your belly, and then what we'll do, have you lie back for a second.
11 days after the gastric bypass, Judith sees Dr. Sarabona for a follow-up exam.
So your incisions are healing up nicely. The benefits of doing this is that, you know, she'll lose about 1/3 to 40% of her starting weight. She'll also have less chance of stroke, heart attack, arthritis. Listen, it's good. I'm not going to pull them off. They'll just come off on their own, but there's no infection. They're healing well. Right. Why don't we put you on the scale?
Judith has had to completely change her eating habits. Each meal consists of just 2 tablespoons of food, and will for the rest of her life.
Even though Judith lost 18 pounds, she knows it will probably take a year or so to lose the 120 pounds doctors want her to drop.
So down 277.
Wow.
You were what when we started?
Well, in August I was 286, but I think it went up to
You
about
went up.
295.
Yeah, I think before surgery, you were and you said 295, right?
Close to 295 if it wasn't.
Yeah. So you've lost approximately about 18 pounds or so.
That's wonderful.
At 7 in the morning, Mona and her father arrive with Summer, prepared for a long day of surgery. Mona has a lot on her mind. Her daughter's erratic health may get even worse, and her father may find out today that he has cancer.
He's being really brave about it. He doesn't want to kind of show me that he's upset about it or worried about it, because he already knows I'm worried about somewhere, and he doesn't want to add to my worries. But I know deep down it must be awful coming all this way and finding out you have this, and on top of that, you know, you don't know what's going to happen the next day. You don't know you're going to be asleep. They're going to be performing on you. You don't know what's going to happen to your body.
Okay?
Yeah, she's having a transplant.
Okay, come on.
This is the donor.
Khalid and his granddaughter will be in surgery at the same time. No matter what doctors find out about the growth on Khalid's kidney, Dr. Butt must remove the failed kidney from Summer's first transplant.
First in, first out.
It's good.
You know,
We're going to blow up a balloon, okay, my darling? You hold Mommy's hand. Hold Mommy's hand and let us blow up a little balloon. Good girl. That's a good girl. Mom.
Well, we're going to take out the little girl's kidney and prepare the bed for reimplantation of the new kidney. When we take out the grandfather's kidney, it has a little tumor on it, so we're going to cut out that tumor and check it out microscopically. If it is a benign tumor, then we'll go ahead and use the kidney. If it isn't a benign tumor, then we'll just close up and come back some other day.
Miss,
With a different donor, of course.
First, Dr. Butt will remove Summer's failed kidney.
This was the only living part of the kidney left.
It's a stent.
Two-thirds of this kidney is dead and may be infected. Dr. Butt will send it off to be tested. If the lab finds any signs of bacteria, they cannot proceed with the transplant. Meanwhile, in another operating room, Dr. Teixeira begins to remove Khaled's kidney. Almost 2 hours later, Dr. Butt receives the lab report with news regarding the kidney he removed from Summer.
It's okay, let him sleep. Hi. I thought I should let you know that everything looks good. We took the kidney out, there is no infection there.
You did my dad's?
No.
No. You mean Summers?
Summers.
Okay.
Everything looks good. Dad's kidney is not out yet, but as soon as it comes out, we'll take a look at it under the microscope. Chances are overwhelmingly good that it's going to be benign.
Dr. Butt returns to the operating room, where Dr. Teixeira continues taking out Khaled's kidney.
It's not going to be cancer. Can't be cancer.
Oh, I mean, the kidney looks healthy.
Yeah.
The fat looks healthy.
Yeah, but
Even though there's a lot of it.
But the cancer happens in healthy kidneys.
I know.
But it can't be. It can't happen twice in a row for this poor kid.
I know, right?
Yeah, if that happens, I don't know. I'll just sit.
And I was a heavy smoker since I've been 10 and 11 years old. I was up to battery back in the day.
Stuff still coming out?
3 years ago, Dr. Augustine Muscatello told Mark Miller he had cancer of the larynx, the part of the windpipe that contains the vocal cords. After extensive radiation and chemotherapy, Dr. Muscatello gave Mark a total laryngectomy. He removed his vocal cords, leaving Mark unable to speak.
There's a close relationship between smoking and the development of head and neck cancer. The risk of getting a head and neck cancer in smokers, and it's said to be 5 times the risk of someone who doesn't smoke.
One morning I just woke up and I had laryngitis, and it was like one day I was alright, next day I had laryngitis, and it turned out to be stage 4 tumor.
When Dr. Muscatello took out Mark's vocal cords, he also removed part of his windpipe, disconnecting his mouth and nose from his lungs. Now he breathes through a permanent hole in his neck that doctors call a stoma. Mark communicates using an electrolarynx. Today, Dr. Muscatello will cut a hole into the back of Mark's windpipe and into his esophagus so that Mark can be fitted for an artificial voice box. Air will be able to pass through his esophagus and out through his mouth, enabling him to speak. With practice, Mark will be able to give up his electrolarynx entirely.
Okay, Mark, you're going to be falling asleep in a couple of seconds. Okay, your esophagoscope is set up. Let's see, it's got some narrowing down here. This is,
Very tight.
yeah, I can't see that far down. He's been having some problems with solids, and this certainly explains it. In the past, we were able to pass the esophagoscope and the bougie pretty easily. All right, we'll get the dilators. We'll pass the dilators first. 28 should do. This one.
Intense chemotherapy treatment scarred Mark's esophagus, causing it to narrow. Doctors must use a hard rubber tube to open it before determining where to create the hole.
He should feel much from this. He's swallowing a little bit. Okay, we'll close that and then we'll do the puncture. Stay away. We want to turn this flap in, right? It's going to be a turn-in flap. So you want to come down in here. That one? Yeah. Put another one above and below. And
A tiny fiber optic camera lets doctors see exactly where to make the incision in Mark's esophagus and windpipe. Next, they slide a tube through the hole in his esophagus to keep it dilated until they put in the voice prosthesis 3 days from now.
If this breaks, we may need another one. Okay, it's in there?
To prevent Mark from coughing up the tube, they anchor it through his nose.
Okay, we can turn the lights on now. Okay, Dr. Kubal, you can start to wake him up. What happened? What did we drop? The diaphragm probe? How you doing? Everything went very well. So we closed off that little opening.
I can't remove it.
Oh, no, not even a sign of it.
Oh, I thought you...
No, he asked if there's any sign of any cancer. The first question he asks me, well, did you see? In my mind, the tumor is gone, and if I saw something that was suspicious, I'd be worried, but I haven't seen anything suspicious since he's had the laryngectomy done. So when I'm interested in talking to him about what we did and where the prosthesis is and how everything went, he doesn't want to hear any of that. He just wants to hear, is there any tumor there?
You know, like I kind of wait for a day when I'm going to feel like normal again. I'm coming to realize that I don't think it's going to happen, and I got to get used to the way I am.
The skin is too big for this bag, I think. It's too much, I think, you know?
It's been over 5 hours since Khalid went into surgery, and they still don't know if the growth on his kidney is cancerous. Dr. Teixeira is having trouble removing the kidney. The size of the growth is making it extremely difficult to remove.
Can you send a knife? Open this one.
Knife, please.
Open anymore. Come on. Open. Okay.
Back to you.
It's almost out. There we go.
Before the transplant can continue, Dr. Butt removes a small section of the growth to be tested for cancer.
Knife to you. Okay, there. Specimen. Where's the jaw? Straight to pathology. They're waiting there.
Yeah, I'm going right now.
Hi, Mona. How are you? How you feeling?
I'm very, very
you okay?
nervous.
Yeah. Okay, we're all done with your dad. Okay, everything went fine.
Yeah.
The lesion is benign, so there's no cancer on it. So Dr. Butt is doing the implantation now.
Summer Razul, only 18 months old, is about to undergo her second kidney transplant. Her family and the doctors pray that this time the new kidney will work. Very carefully, Dr. Butt gives Summer her grandfather's kidney and a chance to live a healthy life.
Actually, we made this side hole.
Now Dr. Butt waits for the new kidney to produce urine, the most important sign the kidney is working properly.
There's some urine there. Let's see if after that... Oh, there's another true drop. Yay!
You getting better?
Much. Much better.
Even though the kidney is producing some urine, it's not yet enough to call the transplant a success.
This poor kid deserves to have a functioning kidney as he leaves here today. Oh, God. And her mother needs a break.
All done?
Yeah. Now we have to hope and pray.
Yeah.
Assalamu alaikum. Good, how are you?
Good, good.
Assalamu alaikum. Assalamu alaikum. Looks good right now.
Yeah.
The kidney is perfusing, the kidney is making small amount of urine. It's not making as much urine as we would like to see, but it will soon. But the tumor was definitely benign, which is wonderful. Hope and pray that it'll soon start to pour out urine. And
the first thing that I'm going to do is take the catheter out. I'm going to cut it a little more.
It's been 3 days since Mark Miller's surgery. Erin McMurray, a speech pathologist, has treated Mark since he first lost the ability to speak.
You ready? Okay, don't swallow. It's a little tight, so you're going to feel some pressure. There's a hole that's connecting his windpipe to his esophagus now. If there's nothing in the hole, every time Mark swallows, his saliva will come right down his esophagus, through the hole, and down to his lungs. Something has to be put in the hole. My job is to fit Mark with a voice prosthesis. I'm going to put the dilator in the tract, Mark, okay? You're going to feel a little pressure. You okay? It's really tight. Just relax, relax. Try to relax. Is that causing you a lot of pain? Good.
Excellent.
Perfect. Just gonna let that sit there. Just relax. For a couple minutes, okay? Because the tract is really tight.
Can you
All right.
turn it, just turn it in.
So what we did is essentially we removed the red rubber catheter, which is connecting the trachea to the esophagus, and we stented the tract to widen the tract so it would be easier to put the voice prosthesis in. So we're just waiting for the tract to expand a little bit right now. You're doing great.
Erin shows Mark how to put in the voice prosthesis and how to care for it. He will have to remove it, clean it, and put it back in on a regular basis.
You ready? Are you in pain? So I'm going to take the dilator out and I'm going to put the prosthesis in. So swallow. When you're ready. No pressure. Pull. Thank you. No pressure, Mark. Mark, I'm going to take the inserter stick off, all right? Okay. So what you see now is the voice prosthesis in place in the tracheoesophageal tract. Tape them up. I brought the glue also. It won't sound anything like his old voice. It'll sound a little wet, a little gurgly, but it's functional, very understandable, intelligible. He'll be able to talk on the phone and do whatever he wants to do. His voice is very functional right now with the electrolarynx. Mark just doesn't enjoy using that. He's embarrassed aesthetically by it. Remember, you take your breath first before you put your thumb there.
9, 8, 7, 6, 5, 4, 3, 2, 1.
There you go. Good.
You know what, Mark? Just take your stoma, or take your finger, put it on the stoma, take a breath, and just let the breath out. Don't even try to talk. Just let the breath out and make sure you're getting a good seal, right? And just kind of work to make sure you got that right motion. So right now, we just feel he's a little tight. He may still be a little swollen from just after the surgery. And that could be contributing, but essentially we think he's just a little tight. We fully expect him to get that really highly, highly functional, really quite expressive sounding voice.
7, 6, 5, 4, 3, 2, 1.
All right.
Mark isn't getting the best voice that he could. So we need to work with Mark to relax this sphincter so that the voice will come more natural and easy flowing. Remember, if the prosthesis, if you cough it out or it pops out or if anything's happened, you have to put the dilator in right away to keep the track open because the track will close up in 24 hours.
Close up in 24 months.
Mark and I have known each other for a long time, and we have a great rapport and a great trust. So we have a great relationship. He's a nice friend. He's been through a lot, and I think I've been there with him through most of it. So he relies on me, and we have a very honest relationship. So it's nice. Your voice will be much better next week. Do you have any questions?
Did you get an authorization number?
I have to call her right now. We're playing phone tag. You're more concerned about the insurance than your voice.
A week later, Mark Miller returns to Westchester Medical Center for a follow-up visit.
Try it. So this is the hands-free speaking valve that we put on last week. All right, go ahead.
977 5 4 3 2 1 7. It's better than I did last night.
Good.
We didn't get as much last night.
I think the hardest part for me is when patients don't get the immediate functional voice that they expect. That having a total laryngectomy is so devastating. It's a life change, and a big part of my job is to counsel them, to let them know that it will get better and it will work. So, getting voice.
Yeah, I think it'll just take a little practice.
We'll come back, we'll work on it. And the plan now is to get him to have his voice restored, to be functional so that he can go back to work as a counselor, and he can go on with his life.
The voice prosthesis is supposed to seal off the hole Dr. Muscatello created in Mark's esophagus. Unfortunately, there's a small leak called a fistula, making it difficult for him to speak using the artificial voice box.
We got some. He's a little tight, but I have very little problem, very little worry about it on a long-term basis.
Yeah, because you did well before.
Right, exactly.
We just changed his prosthesis. We took it out. The track is good.
It's a very tiny leak where it bleeds.
Yeah, let me.
Right there.
But it's not a major deal. It's not making me cough.
Okay, swallow for me. Look at that. Yeah, we'll just let those stitches stay and they'll come out on their own. I will have to see what, again, this is all secondary because of the poor healing based on the radiation therapy. Just let me see what kind of sound you can get out of there. Yeah, I'll do. Take a deep breath. Okay. All right, let's just start. One more time. Mm-hmm.
Do you think that he needs a barium swallow?
For what?
Will that show us where the fistula?
No, I can see. I know where it is. It's right there. So he's an amazing individual. I think he's very positive. When you hear that news that yes, you have cancer, I think most people. I think it shakes them right down to the foundation of their spirit. From my point of view, everything's going fine. There's no evidence of any tumor. Everything is going very well.
3 days after the transplant, Summer's new kidney is not producing enough urine. But doctors are hoping that within a few days the kidney will work on its own. Since the transplant, Mona has not left her daughter's bedside.
We're just waiting for some urine output. Just waiting for her to urinate more, the kidney to kick in.
Oh no!
Hi.
Doc,
how are you? I'm sorry I've been away.
Mona's father, Khalid, is still recovering from his operation.
That's good.
How you feeling?
Yeah, I thought you'll take me with you. You want to learn, is it?
How you feeling? I already had a couple of rough days.
I know, yeah.
I know, I'm sorry.
During the last week, Mona has had to face her worst fears, the chance of losing both her daughter and her father.
When they said that my dad's kidney was benign, there was no cancer, to be honest, that was the best news. It was. Because even if someone did have some sort of an infection, they could have taken the kidney out and no transplant. We could have tried again, you know, but I just didn't want my dad. Because Summer, we know she's already sick. You know, she was born like that. And, you know, but, you know, I just didn't want my dad to kind of have something wrong with him.
I just wanted to look after the little one.
Yeah, we'll keep an eye on her. I think she's going to be fine.
I'm worried about her.
Yeah, I don't know. We're all worried about her. We all love her very, very much. So we're going to take good care of her. Okay? You just relax, okay? We're going to leave it up to us and God, okay?
But 2 weeks later, despite everyone's prayers, Summer has to be put back on dialysis. The new kidney is not working on its own.
So this is on to this everybody was laughing.
When this happens, usually the family is, to say the least, disappointed and frequently quite angry and hostile. I think this mother is a remarkable woman. She has dealt with adversities pertaining to this child right from the time of the baby's birth, and she's sort of gotten used to, I guess, getting the bad news and dealing with them.
Is it leaking? Yeah.
I was very much disappointed in the beginning when I had my operation and I went to see her. She was still bleeding. She was still going in the same trauma as before.
It will probably just take some time. The kidney will start to work by itself. It will take time. It just needs time to heal.
Doctors are a little more hopeful about Summer's transplant this time for a reason. The kidney Mona donated to her daughter did not survive the transplant procedure itself and started to die right away. But in this case, there's no apparent reason why the kidney shouldn't start to work.
If it doesn't work, I'll be so disappointed. I'm not even trying to think about that if it doesn't work. It's just not really in my mind. It's not in my mind right now. I feel so mentally tired that I don't remember the simplest things anymore. I haven't really had much of a break since she's been born.
I don't think there is any limit to the number of transplants that we can do on a single person. What gives out is our psyche.
Bye-bye.
I'm confident that in the next week to 10 days, she will no longer need dialysis and will continue to play and grow and be a normal child. And we'll have the joy of watching her over the next many years.